was so nice to be back in the Big Apple for my first VEITHsymposium. It actually started as a very small meeting held in the Roosevelt Hotel and has grown significantly since then while still feeling very intimate in size. The symposium provides vascular surgeons, interventional radiologists, and cardiologists with the latest advances, new technologies, and changing best practices in diagnosis and management. I definitely nerded out a bit as a former ICURN, listening in on all of the speakers discussing ongoing clinical trials, patient outcomes surrounding all of the technologies and interventional techniques impacting and improving vascular care. There was so much excitement over the new and improved devices for standard EVAR and more complex AAAs, new devices for treating lower extremity lesions by endo and open technologies, and new and improved devices for removing clots and occluding blood vessels endovascularly. Arthrectomy procedures have also been increasingly more popular due to better reimbursement. Some key established but rapidly growing vascular players to highlight that really stood out at VEITH was Merit Vascular, with 2 acquisitions this year, one with their surfacer system and recently acquired AngioDynamics dialysis catheters portfolio, on top of their already established Hero Graft for those patients who have failing fistulas and grafts. They've done a tremendous job laying the foundation for a very therapeutic renal therapies program with no signs of slowing down. Argon Medical, showcasing its newest Kodiak dual-port coaxial introducer kit, which is a unique, robust design that is easily able to introduce therapeutic or diagnostic devices into the vasculature for complex vascular procedures. Not that I can give too much away, but stay tuned for more advancements into 2024. Endologix making waves in the space by adding their new Detour system to its already established EVAR product portfolio. The Detour system is the first to create a femoropopliteal bypass routed through the femoral vein, delivering unobstructed flow from the superficial femoral artery to the popliteal artery, able to target long, complex SFA lesions and chronic total occlusions. Next, Reflow Medical, a company hyper-focused on providing advanced catheter technology that's more durable across all of its products. While I was there, one of the catheters to definitely highlight would have to be the Wingman, a crossing catheter to compact CTOs and peripheral arterial disease, keeping the physician in control of the device advancement and activation the entire time. There were also some newer names in the space creating a lot of buzz at the show. Bentley, a global leader in endovascular treatment for aortic and peripheral vascular disease, announced their first product launch earlier this year in the US. The B-Back, which was rebranded from Go-Back crossing catheter, is designed for steering through CTOs, which is often the most challenging part when treating heavily calcified lesions. There's also a lot more to come from this vascular medical device company in the next year or more. VentureMed Group exhibiting their Flex Vessel Prep System, which uses a unique approach consistently modifying obstructive stenosis and plaque that's able to revascularize AVF and SFA lesions. They just received their CPT code, which will allow them to reach even more patients. Lastly, in the clinical trial phase, with more coming in 2024, Xeltis, a newer name, recently announced the initiation of a clinical trial evaluating its access graft. They claim it is the first ever restorative synthetic graft, a futuristic implant graft built from biosynthetic polymer, which after some months is completely regenerated with live tissue from the patient, and in time this graft actually transformed into a tube lined from the patient's own cells. Absolutely incredible. Vascular disease, with many of its manifestations, is a leading cause of death and disability, affecting a huge number of Americans over 50 years old. Last week's symposium showcased some of the latest radiologic, surgical, and endovascular techniques and technologies to help prevent and reduce further disease. An incredible, huge shout out to all of the healthcare and medical device professionals making a significant difference. And in case I missed anything from the show that was buzzworthy, drop a comment below. I look very forward to next year's vascular show.